Good evening, everyone. My name is DARSHRAAT KAMAHRAJ. I am a first year medical student in University Malaysia Sabah. Today, I would like to talk to you about my preferred specialty in medicine, which is orthopedics. So, what is orthopedics? Orthopedics is a branch of medicine that focuses on diagnosing, treating, and preventing disorders of the musculoskeletal system. The word orthopedics is derived from two Greek terms, ortho meaning straight and paideia meaning child rearing. Orthopedics encompasses a wide range of conditions such as sports injuries, degenerative diseases, congenital abnormalities, and trauma management for patients of all age groups. Orthopedics is important as it oversees the mobility, support, and overall functionality of the human body. Now, let's look at the main focus of this specialty, which is the human skeleton. The average adult has 210 bones in their body, but did you know that a newborn has 270 bones? Those extra bones don't just disappear, instead, they just fuse to form bigger and stronger bones. Now, let's look at the anatomy of the musculoskeletal system, starting off with the bone. The bone is a specialized connective tissue made up of osteocytes and other cells. Together, these cells and fibers such as collagen are embedded in a calcified ground substance. Bones offer many different functions in our body, such as support and protection to internal organs, forming the shape of our body, assisting in movement in our daily life, transmission of weight through weight bearing joints, acting as a shock absorber and mineral reservoir for minerals such as calcium and phosphorus, and finally, the bone houses the bone marrow, which is the site for hematopoiesis or the production of blood cells. Next up, we have the joint. The joint is the union between two or more skeletal components with or without movement. The joint is the reason why we are able to move our body as it helps bones slide against each other and facilitates movement. There are three types of joints in our body. Fibrous joints are joints that allow little to no movement in our body and simply connects bones and hold them in place. Cartilaginous joints are similar to fibrous joints, except that they are made up primarily of cartilage. Synovial joints, on the other hand, are free moving joints that are the ones that facilitate the movements of the body parts, and they are mainly found in upper and lower limbs. Next, we have the cartilage. Cartilage are specialized connective tissue made up of chondrocytes. Their functions are to cushion joints and reduce friction during movement, as well as acting as a shock absorber. Moving on, we have the ligament. The ligament is a fibrous connective tissue made up of collagen and elastic fibers. The ligament functions to connect bones to bones and stabilizes joint as it connects over them. Next up, we have the muscle. The muscle is one of the primary tissues of the human body and is made up of muscle fibers or myocytes. The muscle generates force for movement, contracting and pulling on bones, as well as provides structural support to our body. Finally, we have the tendon. The tendon is another fibrous connective tissue made up mostly of collagen. Its function is to attach muscles onto bones and to allow force transmission by pulling on the bones during contraction. Now, let's look at the biochemical processes that occur in the musculoskeletal system. First up, we have the bone remodeling. Bone remodeling is a continuous process of bone resorption where the osteoclast breaks down old bone tissue and bone formation where osteoblasts mature into osteocytes to build new bone tissue. Bone remodeling is regulated by hormones such as parathyroid hormone, calcitriol, and important as it helps the skeleton maintain its structure and function by repairing micro damage, adjusting architecture for different people, as well as maintaining calcium homeostasis. Next up, we have the calcium phosphorus balance. The calcium phosphorus balance is important for maintaining bone density and strength. It is regulated by the parathyroid hormone and it works by absorbing calcium ion, and phosphate ion into the blood plasma. Thirdly, we have the cartilage biochemistry. As we know, cartilage is comprised of collagen and proteoglycans, which maintain its elasticity and resistance. Moreover, cartilage is found in synovial joints, where there is the presence of synovial fluid. The synovial fluid lubricates and nourishes joint, as well as reduces the wear and tear of it. Finally, we have the inflammatory response. When triggered in injury or disease, this response may involve cytokines, prostaglandins, and enzymes that can break down cartilage. Inflammatory response is more prevalent in muscle tissues when working out. However, inflammatory response can also be found in joints, known commonly as arthritis or sometimes synovitis, or more rarely in bone tissues. Now, one of the famous diseases that is prevalent in orthopedics is osteoarthritis. Osteoarthritis is categorized as the degenerative joint disease characterized by the breakdown of cartilage, leading to pain, stiffness, and reduced mobility. Osteoarthritis mainly affects synovial joint where articular cartilage is present, meaning hands, hips, knees, back, and shoulders. So, what causes osteoarthritis? First off, we have aging, where natural wear and tear occurs in the joint. This is why elderly people are more prone to osteoarthritis compared to younger people. Next, we have joint injuries due to repetitive stress of the joints. Then we have overweight problems or obesity, which then adds the stress onto the joints. Finally, we have genetic predisposition and biochemical imbalances through diseases such as diabetes, high cholesterol, and autoimmune diseases. So, what are the symptoms of osteoarthritis? People who have osteoarthritis complain of joint pain and stiffness, especially after any activity. Their joints are tender, swollen, and possibly deformed in advanced cases. Patients of osteoarthritis also complain of crepitus or crackling sound during movement. So, how do you diagnose osteoarthritis? The easiest diagnosis would be through physical examination, where medical professionals assess joint swelling, tenderness, and range of motion. They then also take either X rays to detect joint space narrowing and bone spurs, or MRI to visualize cartilage at the affected area. Medical professionals may also perform lab tests to rule out other conditions such as rheumatoid arthritis or gout. So let's look at treatments and technologies to combat osteoarthritis. As for non-surgical treatments, patients are advised to change their lifestyle choices through weight management and performing low-impact exercises such as swimming or cycling in moderation to maintain mobility and muscle strength. Patients may also be recommended physical therapy to strengthen muscle around affected joint as well as improve joint stability and range of motion. Patients may also be prescribed medications such as over-the-counter pain relievers like acetaminophen and non-steroidal anti-inflammatory drugs, topical analgesics with capsaicin and diclofenac, corticosteroid injection to reduce inflammation, or hyaluronic acid injection to improve joint lubrication. Patients may also be given assistive devices such as braces, orthotics, or canes to support and realign joints. As for surgical treatments, patients may opt for one of three choices: arthroscopy, a minimally invasive surgery to remove damaged cartilage or loose debris from joints; osteotomy, or bone realignment surgery to shift weight bearing forces from bone to bone; or finally, arthroplasty, or joint replacement surgery to replace damaged joints with artificial implants. This may sound painful, but fret not, as there are advanced technologies being discovered in the current era. There are robot assisted surgery, which enhances precision in joint replacements, improving implant alignment and longevity. There are also 3D printing of custom prosthetics tailored to individual anatomy. Furthermore, there are increased research in regenerative medicine, such as stem cell therapy to regenerate cartilage and platelet-rich plasma injection for joint healing. There is also the option of gene therapy, where medical professionals try to modify genes involved in cartilage degradation. Finally, there's also the invention of wearable technologies such as smart braces that are fit with sensors for biofeedback during rehabilitation. Now, let's look at one of the famous professionals in the history of orthopedics, Sir John Charnley. He is well known as the father of modern hip replacement. Sir John Charnley, a British orthopedic surgeon, is said to have revolutionized treatment for hip arthritis by inventing low friction arthroplasty. How? He introduced polymethyl methacrylate, a compound to securely anchor artificial joint components to the bones. He also included stainless steel for femoral head and polyethylene for the acetabular cup to be fit in the hip socket, therefore minimizing wear and tear of the prosthetic. Mainly, importantly, he focused on reducing friction between the joint surface, therefore the name low friction arthroplasty, as to prolong the life of the prosthetic. Ever since his innovation revolutionized the treatment for hip arthritis, many medical professionals around the world have published books describing his techniques. On top of that, Sir John Chanley has also opened the Center for Hip Surgery at Wrightington Hospital at Lancashire, UK, which has since become a global hub for innovation in joint replacement techniques. Sir John Chanley has also trained numerous surgeons from around the world, thus spreading his methods internationally. In an effort to commemorate him, his low friction arthroplasty has been renamed as Chanley Hip Replacement System in his honor. That is all from me. Thank you very much for your undivided attention. I'll see you around. Thank you.